Friends, in this video we will discuss the muscles of the thigh anteriorly, medially, and laterally. These are somewhat listed on page 191 and 195 in Dr. Walker's book. Anteriorly, we have a very important group of four muscles. We can see three on the surface of the leg. We can't see the fourth one. We'll talk about that in just a second. The anterior-most of these muscles is the rectus femoris. Very nice, beautiful, symmetrical muscle. Kind of reminds me of a herringbone configuration, coming away symmetrically from a tendinous midline structure. So this is the rectus femoris, one of the four muscles of the quadriceps femoris group. Lateral to the rectus femoris, we have the vastus lateralis. Medial to the rectus femoris, we have the vastus medialis. And in the deep aspect of the leg, deep to the rectus femoris, we have the vastus intermedius. What do these four muscles have in common? They have in common that they all insert on the patellar tendon. See how the rectus femoris here inserts directly on the patellar tendon, as does also the vastus lateralis, as does the vastus medialis, as does the vastus intermedius. These four muscles, then when they would tense up, would withdraw the patella superiorly, and the patella, which is now connected by means of this patellar ligament to the tibia. That means the tensing of these four muscles would extend the leg at the knee. So these four muscles again are the quadriceps femoris. Working slightly medially, we have a muscle passing diagonally across the anterior upper thigh. And this muscle is the sartorius muscle. Originates superiorly up here at the anterior superior iliac spine area. Sartorius inserts laterally down here on the tibia. So in summary, the five muscles we're concerned about of the anterior leg, anterior thigh, include the quadriceps femoris, which includes the rectus femoris, the vastus intermedius, deep to the rectus femoris, vastus lateralis, vastus medialis, sartorius. On the medial aspect of the leg, the main muscle that we generally talk about, the most superficial muscle, is the gracilis muscle. Gracilis, which obviously would be an adductor of the leg. Laterally, we have a very obvious fibrinous structure called the iliotibial tract. The iliotibial tract begins at the iliocrest, passes inferiorly to the proximal tibia, and the name iliotibial tract is a very logical name for this strip of fascia. At the superior part of the strip of fascia, we have the tensor fasciae lata muscle. Tensor fasciae lata. Now you remember we talked about the vastus lateralis. Here's the iliotibial tract, and this also is vastus lateralis. The vastus lateralis is a huge muscle of the lateral thigh.